My use of digital planning to plan and prepare for hip replacement surgery has had significant benefits for the hospital. They are able to plan ahead in terms of equipment requirements, implant levels to keep in stock, and indeed the staff mix that we have on the day in theatre, because the plan identifies special or more complicated cases and indeed communicates the simple primary replacements. A bigger picture for the hospital really is in terms of risk management. The fact that every single hip replacement I perform is planned digitally means the chances of the common complications such as dislocation and leg length discrepancy are reduced. It means the risk of complications producing a complaint from the patient is also lowered. And in fact, specifically on that point, because I use the digital plan in the consent process, the patient can see that I've considered potential problems and I'm trying to reduce the risk of those. And that communication, in fact, means complaints are much less likely to occur.